It's time to get naked with Dr. Kate. I'm your host, Dr. Kate Balestrieri, a Beverly Hills-based psychologist, certified sex therapist, and the founder of Modern Intimacy, a national therapy group. So let's dive into all things sex, relationships, mental health, and answer your questions with practical solutions and real answers. Each week, I'll share insights to help you build a healthy relationship with yourself, with other people, and with your sexuality. It's time to start thriving authentically. So let's get naked. And if you like this podcast, hit the download button so you never miss an episode. And don't forget to leave 5 stars and a review. Evan, thanks so much for joining me today. I have to tell you, I got your book in the mail and opened it up, and the cover is perfection. I mean, it's like giggly. The 13-year-old in me was giggling. And also, I just really appreciate the attention to artfulness that you have.
Oh, thank you.
In your social media and in how you write. So how did you come to write a book about all things anal? What was your vision?
Yeah, I don't know. I guess someone must have had a vision for me greater than what I could control. But it really started through just my practice. I started a practice about 14 years ago called Bespoke Surgical in New York. And I started to serve communities, right? Gay community, anal community, post-pregnancy. And you started to kind of put a lot of the differences together into why are people thinking certain things, a lot of myths and taboos versus why are people not getting the sexual education that they need. And then you start to see the ailment side where people are having injuries and issues, or they're not able to engage the way that they want to. And so I kind of worked the other way, which was to say, okay, you're presenting to me with an ailment. How do I fix that? But then how do I prevent that from ever happening, not only to you again, but to anybody else? So it was clearly this kind of evolution. And as I was going through it, I started a company called Future Method, which is all about bridging science and sex into product development. And so it was like, okay, we now have a practice that supports the anal community. We now have products that are able to now improve risk. How do I start kind of filling the void from a sexual education perspective? And not only to everyone that has an ass and engaging anally, but also practitioners and doctors and psychotherapists and sex therapists to really all create kind of a baseline approach specifically to anal sex.
Mm-hmm. I love that. Well, let's jump into your 5 assumptions in the book. That was clever. You talk about the first one, ass isn't for pleasure. And I love that you started there, because probably my entire life, when I've heard people talking about anal sex, and especially as a sex therapist, one of the first things I hear from people who maybe are nervous or not super interested is that's an exit only hole, right?
Yes.
I don't want to do anything that it makes that an entrance hole. So let's talk a little bit about it. Like, is the ask for pleasure or is it not?
I think it's open for the masses to determine what that means, right? But when you look at the entire body, the body has pleasure receptors all over the place, and even places that you necessarily wouldn't think. If you're exploring and it gets you off, it gets you more aroused, it allows for your orgasms to get even beyond that. You start to say, well, wait a second, how do I stop thinking about holes and start thinking about just, do I derive pleasure from the act? And so again, we obviously in the book, we're looking at all these assumptions and looking at these myths and trying to say, well, wait a second, areola and nipples are really for from birthing perspective, right? And feeding and kind of correct, but well, why are they so sensitive? Why do people love to tweak them and play with them and bite them and bring them involved into sexual play? Again, all of these components really fit into why anal should be on the table. And especially I see a lot of women that cannot get off from what would be considered the norm of vaginal penetration, but yet when they engage anally, the angles, the way that it hits kind of the A spot and or the cervix and the vagina creates just that much of a better from a complete orgasm, not only for you, but your partners as well. And no, now think of all those people that don't want to engage anally because of this myth. You now start saying, well, wait a second, think about how heightened your experience could have been.
Right, right. And it's not to say that everyone has to engage in anal play, but there are a lot of folks I think who are really depriving themselves of pleasure because they have these ideas about what the anus should or should not be used for. So you mentioned women, and I'm really glad you did because your next myth is anal sex is only for gay men, right? So not
Totally.
true. So not true, but let's break it down.
Yeah, I mean, I think that, it's not only women, it's heteronormative ideals and ideations, right? Especially in the male space. First of all, everybody has an anal opening and everyone can engage anally. And the definition of engaging anally doesn't need to be penetration, right? We know it could just be external play, licking, rubbing, playing. It could just be finger and or just kind of rim area. It could just be penetration by yourself through toys or devices versus partners, and then obviously going further into different, sexual experiences. So there's
Mhm.
so much that goes into it. I'm a
Mhm.
huge fan of self-exploration first, just because I think it allows you, you're right, you may say, hey, I think I enjoy this, yet when you are doing it, you don't. And what are those reasons? And is it something that I need to see and or surgically correct? And we'll get into that, I'm sure, as we're going through this. But again, this is not only for gay men. I think the key component is for people to understand that it is another aspect to add to your sexual routine and regimen. And if it does kind of stimulate you or your partners in a way that it's open for access, this is why the book, But Seriously, exists, right? It's this guide to say, okay, I'm not just going to go to shove it in and start and then have a bad failed attempt. It is, how do I understand my own anatomy and get the education that none of us ever got?
Yeah. That's one of the things I really appreciate about your book because a lot of the folks that I work with who are coming in to explore their relationship with anal play have had a really bad experience because they were underinformed and or they've seen things in porn and they're like, wow, my body could never do that. And they think that's sort of the end all be all. So there's a lot of rushing into pleasure. And I think
Totally.
yeah, your book does a great job of breaking down how to create a safer and more gradual experience of pleasure. And we're definitely going to get to that in a second.
Oh,
One of your other myths is that anal sex is risky or riskier than other kinds of sex. So let's dispel that.
yeah, I mean, I think obviously everything that we do sexually is risky, right? Just even getting up in the morning and walking out, especially in New York City and all of these components, right? So I think that it's really not being deterred from risk, because a lot of people look at risk and they're like, oh my God, and they start freaking out and it becomes this perseverating component. I think it's taking a step back and saying, okay, everything is risky, no matter
Mm,
what. Even if you were just doing vaginal play with a condom, the condom can break, you could still get pregnant. There's all these other components with STDs. You're licking, you're rubbing, you're playing, you're doing all these other things. So risk is inherent to any sexual behavior. I think that, again, looking at the HIV, AIDS epidemic, looking at where anal played into that, where all of this, and then also with feces and kind of stooling, people think that it's a dirty act and or that people
mhm,
can get quite irritated and potential infections in that space. Nowadays, no. I think the key
mhm,
is, again, is, well, if you are going from nothing to something big and rushing into it, if you are over douching and don't understand how fiber and pre and probiotics and appropriate dieting plays into this, if you're
mhm.
not saying, hey, how do I look at my risk and understand how I should get evaluated and who I should see for prep and all these other components for aftercare, those are the things. I think that that's where the book really goes into trying to empower the reader
Mhm.
to
Yeah.
take care of their own self. And by doing that, because the reality is most physicians won't talk to you about sex. They
Mhm.
won't bring up the aspects. They don't have the expertise to understand the right ways to begin to have the discussion.
Mhm.
So, and we're seeing politically that sexual education is really going to become worse and worse and worse.
Yes.
So this was a, hey, how do I know people want to engage, people are engaging. How do we now provide a
Mhm.
curriculum that's standard across the
Mhm.
board so that people can work from that to
Mhm.
minimize as much risk as possible?
I love that. Well, let's jump into one of your other myths, and I think this one's super common. That anal sex is painful, messy, and causes incontinence. I mean, it is a really rapid sort of chain of fears that gets people to this place of I'm going to be incontinent and have prolapse, and my anus will never be the same again. And I'd love to hear more about your thoughts on one, the prevalence of permanence when people start to engage in anal play that does involve insertion or penetration, and is the anus flexible?
What we know is that there's three types of bottoms, three
Mm,
types of anal cavities. And through my practice at Bespoke, what we do is we study everyone. We study all the muscle components. And there's three sets of muscles in everybody's ass. And when you have prostate bearing male patients, there's a lot of muscle. It's very,
mhm,
very musculature. And the reality is you have a lot of give in that. Whereas non-prostate bearing, so where you're potentially going to be able to be pregnant and deliver, a lot of women, the pelvic floor is much more elastic. You don't have as much muscle. But by understanding all of these dynamics, it starts to set the stage for successful engagement. Now, the
mhm,
ass is in contraction mode all day long. So
mhm,
99.9% of the day, it's basically at the gym in contraction mode. So when you are now using toys and having sex, I actually think even all the straight guys that ever want anal play should be doing dilation periodically for their pelvic floor because we are in contraction. And I always say, think of if we're going to the gym and lifting weights, one day I do biceps, the next day I do triceps. Why? Because I need to stretch the muscle that I
mhm,
just contracted. But yet nobody ever stretches the anal musculature. So when you look at looseness, is it prevalent? Do I see it? I see it. It's so rare. And I think, and
mhm,
even people think of, oh, well, what about fisters and all of this? And it's like,
mhm,
no, actually, that community is so communicative, are constantly evaluating the situation during and after that I
mhm,
don't see that. And
mhm,
again, it just goes to show you that there's a lot of muscle, there's a lot of flexibility, there's a lot of training, and the likelihood of that is low. Now, with that though, in the office, every year or every 2 years, I repeat that testing where we're
mhm,
able to see, well, wait a second, are we seeing a downtrend of pressure? Well, what can we do from Kegels to physical therapy to certain devices that are super easy to utilize that starts to say, hey, I want to open to here to take and enjoy sex, but the rest of the time I want to be contracted. But
mhm,
it's super few and far between. And most of those people, it's traumatic injuries, whether
mhm,
it was a rape situation or an unwanted entry, or they didn't use enough lube, or some of these other stuff that we're talking about in the book to kind of
mhm.
set the stage so that you're able to do what you want, but then when it's finished, you're back to the normal pressures in that space.
So what I'm hearing from you is that it's very rare that there will be some sort of permanent stretching in the anus, and that people can train their ass to have lots of different kinds of movement while also retaining its original shape.
Totally. But I think I even see the opposite where people are mostly too tight.
Yeah.
And
Yeah.
and of what we were saying, there's three different types of bottoms. One
Mhm.
that can about a third of people can fully relax and open themselves without an issue.
Mhm.
2/3 of all of the people in the world have some element of anal issues, meaning it's too tight, it won't relax, you tell it to relax, and functionally it doesn't. So their
Mhm.
first experiences are either painful and or bleeding, when the reality is that by analyzing, like we said from the book, what you're able to do is to say, okay, well, which pelvis do I have? How
Mhm.
do I start teasing the tissue to learn how it performs? And
Mhm.
then before it gets to the painful, bleeding, looseness side of things, you've either seen someone that understands the right way to take care of you, Or you can obviously reach out to me, DM me, we could communicate, but setting that stage for success. It's the
Mhm.
going from nothing to something big and the non-education in between that fucks the entire thing up.
Yeah, well, let's talk about that. So, in your book, you are really beautifully prescriptive on how to begin a sphincter training program, right? You even talk about Botox as an
Yeah,
option.
totally.
So, can we kind of go over some of the ideas that people might think about if they're looking to train themselves to be able to accept something in their ass?
Yeah, I think first of all, we spoke before, self-play is key. I think you don't want to bring partners into it right now. You want to understand your anatomy. I think it's also defining what is anatomy. Anal sex is not overtly very complicated.
Mm-hmm.
It's two components, it's skin and it's muscle. How do we get the skin to open and
Mm-hmm.
relax, but also be strong, right? Because the acts of sex are significantly elevated in pressure. So
Mm-hmm.
we need the skin to open but be strong and expandable. And we need those three muscles that are there to learn how to relax. And not only learn how to relax in unison. There's
Mm-hmm.
three muscles that are just not listening to each other. And for those 2/3 of people in the world, it's not coordinated. So by starting with small toys, what you're doing is you're learning how to strengthen the skin, get the skin to actually be more elastic, and learn the muscle memory of those three muscles so that now, okay, I am engaging anally. It learns how to fully open and open in the right way. And so the book details kind of all the different anatomy so that you can understand. Obviously, I'm simplifying it here. There's more that goes through it, but then it
Mm-hmm.
gets into anal dilating. People think they can go from nothing to something big and someone can just get behind them right away. And that's, 70 to 80% failure rate.
Mm-hmm.
The key is over 6 weeks is starting with small toys and working from small into medium and then going from small, medium into large. And it's just like going to the gym. Give me 2 to 3 days, 2 sets of 12. It's not a huge deal. You could, if you want to get off and feel sexy with it, great. But a lot of it in the beginning is very mechanical because I want you to learn how do you interface with your own body, feel the pleasures. There shouldn't be pain. There shouldn't be bleeding. If there's discomfort, that's okay. In the beginning, you're kind of learning and navigating, but the book details the entire protocol. I like glass toys. I didn't really see any out there that I thought would be amazing for what we learned at the practice. So I developed my own, which is on through Future Method. And it's basically a glass dilating kit, small, medium, and large. Glass holds any type of lube really, really well. It's super easy to clean. And I need something that is powerful and strong to work the skin and the muscle. A lot of the other toys, the way that they're shaped, the way that they're processed, and all this stuff, and their materials just don't lend itself to what we're talking about, which is skin strengthening and flexibility in the muscle and the skin overlying it. And it takes time, 6 weeks. Then it's like, okay, I feel really good. I'm taking the small, medium, and large. Now I want to have sex. Okay, you need to bring the toys into sex play or use them right before sex. And then you're only on top, in control from a position perspective, so that you're starting to learn how to navigate all of these different situations. And then we detail over in the book a lot of like, well, what if something goes wrong? What if I am having pain? What if I am bleeding? What if I am seeing restriction? It details through there saying, okay, you may be in middle Idaho and not have access to care. What are the things that I can do to help move myself in the right direction? Or do I need to be seen by somebody because there's something that's having an issue and it needs to be corrected in the office or in surgery?
And how would someone know what that threshold is for themselves? Because a lot of folks will experience discomfort, but they also can move beyond it and their body heals and they're okay. And some folks really get nervous and they don't know, gosh, am I at risk of something becoming more serious if I don't get this looked at?
I think it's just like what you said. I mean, the discomfort side should be transient And it should be, as you're progressing through the dilation, you should see that it's less and less of an issue, right? We also talk, if there is discomfort, great. We talk about suppositories and lotions, taking 3 to 5 to a week off, starting again, and then seeing if it persists. Sometimes it's a mental game. I say what I do is 60% functional, 40% mental. So that also is, if you're perseverating, well, that's also an issue that we need to figure out and start to say, okay, how are we going to connect everything so that you're able to progress through? And again, if it's painful, if there's bleeding, it's like, stop. Like, you shouldn't let yourself get to that if you're doing the protocol correctly. And then if you are experiencing that, it's saying, okay, how do I say no and raise your hand and say, I need help to figure out. And a lot of it is, of those 2/3 that can't engage correctly right from the beginning, about half of those can learn through this process how to get themselves on the correct side of bottoming. The other half, I need to do something, whether it's in the office, whether it's anal Botox, and we can talk about that, whether it's physical therapy and really having someone teach you the right way to poop, the right way to engage, the right way to understand your own musculature. And or do I need to do something surgically to correct something that's causing the issue?
Yeah, I mean, a lot of the work that I do with folks in sex therapy is about helping them develop that interoceptive wisdom, right? So interoception is the perception of what's internal, right? Getting to really be present with the sensations in your body and to slow down enough to really notice them. So, like, to your point, a lot of the perseveration is a disembodiment. And when we can come back into the body and really stay with what is my body telling me, and how do I communicate back to it or with it, right? Because we are our bodies. People can start to kind of learn to breathe into or recognize ways that they are either working with or working against their anatomy in the process.
100%, 100%. And I think it's like if you and I are hunched over at the computer and you say, okay, can you arch your back the correct way? A lot of people don't know how to reposition their shoulders. But if you and I teach them and you start learning muscle memory and you start isolating, you're actually able to achieve that. And it's the same thing anally. And that's what you learn over the 6-week course of using the toys, is you really can start learning, oh, if I push out and I breathe in a certain way, now those muscles start listening. And it translates to better pooping, because we see a lot of ailments from hemorrhoids to tears to issues anally from poor defecation, approaches. Also pregnancy. So the book is it's not only for gay men, it's for anyone that has an anal opening, and specifically looking at post-pregnancy or before pregnancy. How do I decrease the pressure so that I don't get these hemorrhoids that people are constantly getting? The fissures. How do I now understand the pelvic floor that I have so that I'm able to do all the things that I want with it and do it in a better way?
Love that. Well, what is the one piece of advice that you would leave people with about playing with their ass that we haven't talked about already?
A couple of things. One is, there's so much pleasure in the act for so many people. Not only you, but obviously the partner and partners and people involved in that. And so the key component for me is, how do you, one, figure out where you want to go, right? It has to be a conscious decision of, hey, I do want to engage. Then it's, okay, how do I now analyze my own anatomy to figure out the right steps to get to the end result? I just feel so many people in the world that don't get that pleasure side, right? Also, they've had a bad experience, because so many of us, even in vaginal engagement, just from the first time, think about how many people have such a terrible first experience where it doesn't allow them to go further and further into their own sexual being to start defining the pleasure side. I see anal sex really working so many ways to stimulate not only the prostate, but non-prostate bearing individuals, the angles, the way that it starts to stimulate and create the P and A spot orgasm creates so much of a better experience sexually. And again, you would never know it if you're not saying, hey, I want to see what this is all about and how am I going to get to where I need to be. I just think it's, again, start kind of just looking at pleasure, the entire body, as saying to yourself, how do I start enhancing the pleasure for my sexual experiences? Not focused on, oh, anal, vaginal, oral, all of these. There's so many ways that nobody's tapped into that I think would just heighten everybody's experiences. And it's a shame in our once in a lifetime to not be able to experience that for themselves.
I love that. I love that. Well, thank you so much. This has been such an informative conversation. Love talking about the ass with you. Where can people find you if they want to learn more about what you do or your products and if they want to work with you?
Yeah, sure. So for me, it's Dr. Evan Goldstein, Dr. Evan Goldstein on Instagram. You can always DM. It's my life of everything that I'm doing in the office. Plus, I have two boys with a partner of 18 years. So a lot of crazy stuff that happens there. Bespoke Surgical practice is on all the handles is Bespoke Surgical. The product company is called Future Method. It's the Future Method on Instagram, but everything else is futuremethod.com. And then obviously the book is But Seriously. It's butseriously.com, and it's on all the channels, and obviously the website has all the links to that. So thank you so much for supporting what we're doing. It's awesome. This is going to be a great endeavor for the years to come. That's for sure.
I love it. Amazing. Well, thank you again. And thanks everyone for listening. I will see you next week. Thank you for listening to Get Naked with Dr. Kate. You can follow me on Instagram and TikTok at Dr. Kate Balestrieri and on YouTube at Modern Intimacy. If you have questions you want answered on the podcast, feel free to email me at question@getnakedpodcast.com. Our Modern Intimacy team is here to help you and to provide you with support. Feel free to schedule a free 30-minute consultation at the link in our show notes. And don't forget to join our newsletter for insights, surveys, and articles sent directly to your inbox. You can sign up at modernintimacy.com/newsletter. New episodes drop every Tuesday. I'll see you next week. Disclaimer, this podcast is not a substitute for therapy and does not constitute a professional relationship with me, Dr. Kate, or with Modern Intimacy. This podcast is for education and entertainment purposes only.